else that has spoken. I will be speaking about private public partnerships in the context of the Flying Doctors Investment Company. Basically, we started this company 10 years ago, and we started it because my younger sister, she was 12 years old at the time, we're trying to transfer her from one place in Nigeria to another where she could get treatment. And unfortunately, there was no way of doing that by air, and the distance was too long to be traveled by ground, and she died. And I was living in England at the time in medical school, and I was really, really heartbroken about the situation. It made me want to move back to Africa. It made me start thinking about African healthcare systems, and thinking about how the fact that something so easy and accessible and free in the UK was sort of completely unavailable, not just in Nigeria, but in the whole of West Africa. And the more I started reading about African healthcare systems, the more motivated I became to do something about it. So 10 years ago, right after I finished my research fellowship in Tokyo, I moved to Nigeria to start an air ambulance company. And primarily, we had nothing to do with government at the beginning. We were just serving the oil and gas industry. But as we continue to serve the oil and gas industry for air ambulance, for offshore medical evacuations, getting their offshore workers, they continue to ask us for more and more stuff. So they wanted to equip their clinics offshore. They wanted to equip their remote clinics. They wanted staffing solutions. And before we knew it, we were doing a lot more than air ambulance services. So eventually, we started doing multiple functions under the brand of the air ambulance services. During that time, I started reflecting on my choice of degree, because I was running, I always imagined myself as a doctor in the ward, and I found myself in a situation where I was running a big business. So I went back to school and started a master's in economics and finance. And at the same time, I started doing investments in other healthcare companies, because one of the biggest issues for me as a young doctor starting a company was finding capital. So last year we rebranded as the Flying Doctors Healthcare Investment Company, which is an end-to-end healthcare and wellness firm that invests across the healthcare value chain. So we have our operational companies in the air ambulance industry, in the hospital and clinic, in training and consulting. But we also have our investments. MDAS Pharmaceuticals is one of our investments, and they invest in, they operate low-cost diagnostics facilities and supply medical equipment. We have Lifestyle Pharmacies, which is also low-cost retail pharmacy, and they have their branches of their pharmacies in lower cost areas, and about 30% per SKU difference in price, so they're 30% lower than the premium pharmacies. So they offer a real opportunity to bottom of the pyramid customers. Chisco Express, which is a medical logistics company, access to 500 trucks, which truck the pharmacy, the equipment and the drugs all over the country. And our latest investment is in electronic medical records and telemedicine through Helium Healthcare. And I'll be talking a bit more about that later, and how all of these public-private partnerships and investments play out, and how the private sector can really have a transformational role in healthcare in Nigeria and across Africa, because we have projects not just in Nigeria but also across Africa. But first, I was very fascinated by Mohit's presentation, because I continually think about India and the big differences between India and Nigeria. And this is one of the major differences. So anybody from India will know that there's a lot of rich people in India. In fact, there are more millionaires in just the city of Mumbai than there are in the whole of Nigeria. So India has far more rich people able to buy healthcare in just Mumbai, in just the city of Mumbai, than we have in the whole of Nigeria. So as you can see from this slide, there are 57,600 millionaires in Mumbai. There are only 12,300 millionaires in Nigeria. So I think that's a major difference that we have to think about when we talk about healthcare. So Mumbai and Delhi and Kolkata have either the same or far more millionaires than Nigeria. So they have a lot more rich people. So when you're designing healthcare systems for private healthcare systems, you have to consider that India has so much more in terms of people at capacity to pay than Nigeria. Just to talk about India again, India has 9,000 people in the category of $9,000 and above. Those are people that are on a yearly income or wage of $9,000 and above. They have 100 million people in that category. Can you imagine? That's an entire country of rich people, right? Not thinking about the poor people, but just in terms of the rich. They have 9,000 people, 100 million people in the category of $9,000 and above. Nigeria has 2 million people in the category of $9,000 and above. So remember this slide, India has far, 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 far more rich people able to pay for healthcare compared to Nigeria. But if you look at Nigeria and India again, if you look at the number of extremely poor, which is close to the bottom, you can see that Nigeria actually has 90 million poor people, while India only has 71.5 million poor people. And this is despite the fact that India has 1.3 billion people and Nigeria only has 190 million people. So India has far, 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 far more rich people able to pay for healthcare. But somehow, Nigeria has cornered the market in poverty, and we still have far more poor people to take care of that cannot pay for healthcare compared to India. So this is like the major difference that I tend to point out when we're comparing Nigeria and India in terms of capacity to pay and in terms of what they've been able to do with their healthcare system. India has far more rich people. Nigeria has far more poor people. So when we're designing healthcare and taking models from India, this always has to be at the back of our minds. But nevertheless, I think that the main ways that private sector helps in the healthcare system in the area of research and development, backward integration, efficiency, we can decrease prices, we can increase speed. And as an investment company, obviously, we provide investments to companies doing innovative things to drive down the price and increase efficiency in healthcare. So this is a good example of this. This is the molecular lab that we installed for Ogun State on a build, operate, transfer model. So they were able to pay quite a small price at the beginning. They didn't have to buy it outright because we could provide financing. And because of that, they could spread the payments over a period of months, but they could start using the lab immediately for their COVID testing. So all of the projects that I'm talking about, they're related to COVID. So this was one of the COVID projects we did as a Flying Doctors Investment Company. The second was I saw, testing was a big problem. And the first project that we did was on molecular labs. But I saw the way that testing was being done in Ogun State. Literally, a team was going out to meet the patients, and they were going in a bus, like a team of 3, and they were going to the patient's house. And then they were taking the sample in the patient's house, and then they were going to the next person's house. So, there was so much time being lost on the journey to a patient's house, having to call, having to ask for directions, and then going into the patient's environment, risking sort of being infected, touching all the surfaces that the patient had touched. Maybe the patient is even in the bathroom, so they have to sit down and wait in the patient's living room where the patient comes down for the test. It was, very, very time consuming, and it put the healthcare workers, the lab scientists or the doctors going out at extremely high risk. So we went back to our little research and development lab and developed and designed and built Nigeria's first testing booth. With this testing booth, as you can see, the healthcare worker no longer comes in contact with the patient at all. So they can take the test without any direct contact. And I did mention that the PPE, every house you go to, you have to change the PPE. You have to change what you're wearing. So they'll come back into the vehicle that brought them, and then the PPE, and put on another one. And sometimes the cost of a full set of PPE can be up to 50,000 naira, which is, roughly about $70. That's my rough calculation anyway, per set. And, you know, I was asking them, are you people filming a music video? Do you think this is Hollywood, that you have to change a very, very expensive outfits? Like some of the outfits I wear to work don't even cost this much. And you're changing these outfits like every single time you do a test. So another major advantage of the testing booth is that they can remain in minimal PPE and not have to change so often. And actually, if you're doing 100 tests a day, then the testing booth buys itself in just a few days, because it makes it so much more efficient, so much faster, and so much cheaper. So this was another private sector sort of innovation that actually saved the state money by bringing that, you know, I mean, civil service institutions usually do not have R&D departments where they can put money into research and money into building and money into design. But the private sector, we do have access to professors, design engineering professors, and we do put money into R&D to create products. And this was a product that we created that was installed in Ogun State, which has transformed the way that they test. There's also the Landmark Isolation Center, where the business group that I belong to, the YPO, we raised about £500 million naira initially to put together isolation center, COVID-19 isolation center, for people to work with the state. So this was private sector funding raised to work with the states from all private sector donors to augment the public COVID-19 response. It's a 70-bed facility. This was actually, I put a picture of us building it because, you know, these were the days when we were there every single day, putting in plumbing, putting in electrics, building up the tent. So I love this picture because it reminds me of what a grind it was. But now we've had nearly 200 patients go through this center. Flying Doctors Investment Group was involved in supplying the oxygen, supplying the equipment there, as well as running and recruiting the people that work there. And this is a really great example, I think, of how private sector donors can work with the public sector to augment their facilities. This is a COVID testing vehicle, which we also developed with similar advantages to the booth. And this is the spread of our molecular labs, equipment, supplies, testing centers over the country. So already we have huge spread in terms all over the country. And it's not just huge spread for spread's sake, but actually making equipment easier for government to buy, making government processes more seamless, through all of our investment companies as well, making it more seamless, making it more transparent, making it cheaper for them to run these processes. So these are the kind of things that I said at the beginning that the private sector can bring to government in terms of research and development, in terms of innovation, in terms of reducing cost, increasing efficiency. And I think I've described a few examples of the way that we've been able to do this during the COVID epidemic. So the way forward, I think for me, is 2 years ago, I wrote a book called Fixing Healthcare in Nigeria. And it talked about 5 major healthcare pillars of reform that I suggested that, you know, we could embrace all over Africa, not just in Nigeria, that would help us develop a better healthcare system. The first one was primary care expansion. So we know that investments in primary care reduce cost. We know that it's cheaper to treat a patient in primary care than to treat patients in hospitals. We know that hospitals are not supposed to be the main focus of care. They're supposed to be a safety net for patients that fall through the net of primary care. So the more that we can invest in primary care, the cheaper that we make our healthcare system overall. So primary healthcare expansion is really key. And maybe we shouldn't expand the same way that Western countries have expanded. So one of the big ideas that we had post-COVID is actually turning all those testing booths that have been distributed around the country into telemedicine suites. And we can do that through the investment company and our relationship. We can do that very cheaply because of our investment in Helium Health, which is the West Africa's leading healthcare technology platform, to provide primary healthcare through these testing booths. So that the money that is budgeted, the little money that we have for primary care is not going on cement, it's actually going on care. Because we're using existing assets and we're using technology and innovation to try and make the cost of delivering primary healthcare cheaper. The second pillar was around tertiary healthcare centralization. So I think this is cultural, but there are 36 states in Nigeria, and every state thinks that they have to have vascular surgery, brain surgery, they need to be doing ECMO, they need to have the world-class ICU, they need to have everything in their state. And even the UK, that has a budget of 250 billion almost dollars for healthcare, does not have everything in every single area. They have centers of excellence. They have tier 1 medical facilities where they refer patients to, serious patients to. And why that is so important is because it allows for specialization and it allows for economies of scale. I say in the book that there's a reason why Dangote does not have, Dangote, for the people that are not from Nigeria, Dangote is the biggest cement, the richest man in Nigeria and the biggest cement producer in Nigeria. And when I'm making this point about centralization, I say there's a reason why Dangote does not have a factory in every state. Because it would be wasteful, right? It would be a waste of resources. So centralizing tertiary healthcare is really, really important, making sure that we have all the experts that we need in one place and that we can refer primary healthcare patients to these tertiary centers of excellence, these tier 1 centers of excellence, even in whole America. Still, when you hear about Emory, when you hear about Mayo, when you hear about Cleveland Clinic, these are tertiary centers, centers where the most difficult cases go to, and they are firm referral networks for being able to refer these patients to these tertiary centers. In India, you talk about AIIMS, where all of the best doctors go and they perform a huge number of procedures. So they're able to bring down the cost of healthcare through economies of scale. And that's something that I think is a key pillar. Focus on maternal and health, I won't talk about so much. I think everybody realizes that's important. Task shifting. I used to be against task shifting when I first qualified because I'd spent 8 years studying at the time. So why on earth would a nurse now come and start saying that they want to do my job, or a pharmacist? But I have begun to think more rationally since I started studying economics. And they call economics, they call it the dismal science, because they say that, you know, your mother will tell you that you can have everything in life, but economics will tell you that you need to make trade-offs. And one of the trade-offs that we need to make in Nigeria, because of the small number of doctors and because of the huge healthcare needs, is embracing other healthcare professionals to perhaps do jobs that traditionally doctors did. That also brings down the cost of healthcare. And I know that no doctor will want to hear this, but in some cases, according to some studies, it actually increases the quality, although we won't say that too loud. So that's another arm of healthcare. And the last one is sustainable healthcare financing, which is, you know, what this presentation is about. How can private sector funding and blended funding come in to assist the private sector? There's no way that Nigeria can do this funding on its own. And let me explain why. We have a budget of about 25 billion naira. That's our entire budget per year. That's Nigeria's entire budget. And we have about 1 billion, in the range of 1 billion, going into healthcare for 200 million people. I said earlier on in this presentation that the UK, that has almost just about a quarter of our population, is using 250 billion to do their healthcare with the NHS. And people are still complaining about the NHS. But what we are spending on 200 billion people cannot even meet the needs 100% of just 65 million people. Nigeria's health, if the UK NHS gave us their budget for a year, it would pay our budget for at least 200 years. So there need to be other sources of financing coming in. And we need to be able to embrace this innovation, this spirit of R&D, to be able to do a lot more and deliver a lot more services with a lot less money. And I think that India has been so great at being able to do that, delivering services at 1% of the cost, 2% of the cost of an American hospital with the same quality. And these are the things that we need to learn. But we need to do it even more efficiently because, like I said, they have more rich people, but we have more poor people. So I'll conclude by saying I hope I haven't overspoken or spoken beyond my time, by saying that, you know,
Sorry,
this is such a great
so
moment
you
in
have.
history.
I would suggest if you can round up, but it's been very interesting listening to you, Ala.
So yeah, I'm rounding up now. I hope I haven't spoken over my time, but I'm concluding by saying, you know, this is such a great moment in history. And I think it's going to break some economies and break some countries, but it's going to make some countries stronger. And I hope that Nigeria is one of those countries that is going to, we're going to come out stronger out of this. And we're going to realize, you know, the importance of healthcare investment. We're going to realize that healthcare is an investment, not a cost. And we're going to leverage the innovation, the financing, the R&D potential, and the energy of the private sector to improve quality, expand access, and reduce cost of healthcare in Nigeria. Thank you.